Good evening and welcome to our COVID-19 update on Channels Television. I'm Millicent Walker. Here are some of the highlights this hour. Today, NCDC WHO collaborates in establishing more testing centers across states. Secretary to the Government of the Federation appeals to religious leaders to seek the face of God in dealing with coronavirus. And more European countries ease lockdown restrictions as citizens grapple with returning to work. And while we expect the Presidential Task Force on COVID-19 briefing, the Lagos State Governor has been speaking on the strategies to flattening the curve on COVID-19 in the state. Mr. Babajide Sanwo-Olu reacted to the rise in cases in Lagos, has asked residents not to panic, attributing the jump to the success of the active case searches taking place in communities across the state. The governor also comments on the coronavirus stigmatization, saying the virus is not a death sentence. He was speaking today in a press briefing at Muneerah, Lagos.
People that are suspected to have the virus have declined to present themselves for testing and treatment, more often than not opting to manage their symptoms by themselves, or in extreme cases, going to private hospitals and lying about their symptoms or travel or contact history. These actions are extremely unfortunate and dangerous. Not only do they have wide-ranging ramifications on every one of us, it also portends great consequences for our ability to record any meaningful gains from our lockdown that we've all been subjected to. The isolation centers, which we continue to say they are not death centers. We have had many positive and uplifting stories from those who have been discharged from these facilities. They are being treated and discharged. In fact, the earlier a diagnosis, the greater the chances of making a full recovery. Please be reassured that COVID-19, despite its contiguous nature, is not a death sentence. In this vein, I therefore implore all those who have tested positive to this disease or are suspected to have contacted this disease not to be afraid of presenting themselves to our isolation facility, to any of our isolation facilities for expert management with a variety of treatment options that are available and that we have seen. I would also like to urge members of the society to desist from stigmatization. Anyone who has been cured of this virus, there is absolutely no reason for us to begin any form of stigmatization.
Now from the Nigeria Center for Disease Control, here's a look at the breakdown of cases across the country. Lagos now has 376 cases, the FCT 88, Kano has 36 cases, Osun with 20, Oyo has 16, Edo 15, 12 in Ogun State, Kwara 9, Katsina 12, Bauchi 7, Kaduna 6, Akwa Ibom has 9 cases, Delta 4, Ekiti and Ondo each have 3, while Enugu Rivers and Niger states have 2 cases, with Benue and Anambra recording 1 case each. The center says overall 170 persons have been discharged, 21 people have so far died. Even though the Presidential Task Force is following on the medical protocol in dealing with COVID-19, the Secretary to the Government of the Federation, Mr. Boss Mustafa, is appealing to religious leaders to lift the nation up in prayers to defeat the pandemic. The SGF was speaking while receiving the new primate of the Anglican Church of Nigeria in Abuja. Both men believe that now is the time to seek God's intervention.
This is the time to pray and call upon the God of heaven for his mercy upon our nation. Nobody prepares for this pandemic. I know it's very difficult for the churches now that have been used to congregating. But I told myself when I was live streaming the Sunday service from my local church, and I said, well, probably we're being reminded that the church is not the building.
It's not the building.
Except for God. You can see how countries with well-established medical infrastructure are crumbling under the weight of COVID-19. Except for God, our story would have been different.
This is an uncertain time, and the challenge is getting more and more. And we want to also plead that our people be patient. If we will stand in faith, in hope, and the little support that we can give to one another, we are trusting God that we shall defeat COVID-19 together.
While early detection and treatment still remains an important measure to containing the virus, the Nigeria Center for Disease Control, NCDC, is not relenting in this fight as it collaborates with the World Health Organization to set up more testing centers across the country. The Director General of the NCDC was speaking during a working visit to Delta State on ways to ramp up testing of residents in various communities. He was accompanied by the WHO field officer in Nigeria, Ms. Fiona Bracker, during the visit.
Viruses don't understand where Delta ends and where Edo starts, or where Delta ends and where Anambra starts. These are borders we draw for political reasons in order to provide governance for the country. Bacteria and viruses don't recognize that. So we are looking, my role is to serve the whole country, and we prepare for the worst, but hope for the best. So our working assumption is that the whole country will have some confirmed case eventually. Almost every country in the world now has at least one confirmed case of COVID-19. So we have to work on the same assumption. If it doesn't end up happening, we'll be grateful. But right now, the indications are with the spread of viruses in populations that every state will eventually be affected. So our role is to encourage, support every state in preparing.
This is a critical part of the whole response strategy, that you detect cases early, you test, you isolate them early. That is how we'll be able to control this. So we are working together with NCDC to see how we can ramp up this process. And certainly Delta will be among those states that will be critically looked up for testing capacities.
Joining us for more on limiting the spread of the pandemic from our Abuja studio is Dr. Muneerah Hamer. He's a consultant public health practitioner. I'd like to thank you for joining us at this time.
Thank you. It's my pleasure to be here once more.
First, tell us what you've observed, social distancing and perhaps the stay-at-home order in the FCT.
Well, I think presently, we are on the second leg of the lockdown. The first 2 weeks were nothing to write home about. People were basically going about their thing, going to their offices, and as much as possible not complying to the governmental laid down provision on lockdown. But I think the second stage of the lockdown, which we are into, I think we're in the first week now, about to go into the second week, which the president himself declared, has shown some level of success, some level of compliance. You see the law enforcement agencies are not just becoming firmer, they control the influx of people better. And people get to now understand the reason why that the lockdown directive is basically for our good. It's not meant to enchant anybody. It's one of those strategies, a very effective strategy in our intention to flatten the curve of infection. So I think so far so good. In FCT Abuja, people are complying, but I think when we go to the suburbs of Abuja, well, the story needs to be taken to them. The gospel needs to be passed on to them. Or the essence, the reason why they must, as much as possible, observe this clampdown. I mean, this lockdown, pronouncement as much as possible. Observe it, and it's for everybody's good eventually.
All right, Dr. Hamer, just a moment. We understand that the Presidential Task Force briefing, getting ready, as you can see, or shortly on your screen, will be joining the live broadcast as soon as they're ready and it comes up. But back on the issue, because there also appears to be a lot of delay in terms of sitting and waiting for the NCDC to come and test, and then another wait for the results for a lot of the states. How do you think we can take care of these lapses?
Yeah, I just like I've always been pronouncing in every forum I have the opportunity to speak. I still think there is a need for us to do more testing. Kudos to the commander-in-chief who gave the directive, who actually directed NCDC to improve their testing. We are looking at a directive that we need to do at least 4,000 tests daily. That is a good one on the part of federal government. But I still think it is still not adequate, because we're looking at 200 million people. And the fact that coronavirus is a disease, that is, the issue, the phenomenon of community spread, it has come to be. The rate of spread is unimaginable. It is so, explosive. So that the essence of, we still need to talk about doing more tests. Now, certain figures, certain authorities have mentioned about the issue of doing what we call the rapid diagnosis test. Now, a lot of authorities also do not seem to agree with the dictum, the issue of rapid RDTs, maybe because of they often said expressions regarding its validity, its validation, as well as specificity and sensitivity. Now, we all know that as much as possible, the RDTs that we are talking about, especially the ones that are coming from a certain part of the world where where they have been exposed to COVID-19, and as much as possible successfully countered it. Now, these have gone through all those stringent measures, those guidelines WHO had put into, giving the manufacturers to follow, especially when what we call the emergency use listing that was pronounced in January 30, 2020, the 30th of January 2020. Now, a lot of these manufacturers have actually gone through all that, guidelines to be able to come out with test kits that should give us sensitivities that are over 90%.
Are you advocating that we use the rapid response tests kits?
Very good. Now, what we're saying is that the essence of it is to ramp up tests, because we're looking at 4,000 is not enough. You're talking about over 200 million people. Now, if we're able to use the rapid diagnosis to plug this loophole, now we have a situation whereby, because we're talking about it has a very excellent negative predictive value. It's able to tell you people that are negative. Those who are negative are negative. You don't have to make any bones about it. The PCR that NCDC is always talking about cannot turn somebody who is negative to suddenly become positive. So we are saying, if those ones, if we can actually scale up the use of RDTs now, because of the challenges we're having with the PCRs, because of large population, and then the turnaround time we're talking about, of course, the cost implications and so on, and of course the fact that it's not private. A lot of people would rather want to know their results in their privacy of their homes before they actually go out to now know what actually it is. A lot of people want to know what their results are, so that they'll be able to, as much as possible, see what they can do for themselves.
Yes, but Dr. Hamer, the WHO, because we've had the country officer come on the program, and we've also been hearing from the NCDC DG, who has spoken about the inaccuracy of the rapid response test kits. So I guess that's perhaps, we wait until indeed these authorities approve. But we understand the Presidential Task Force is beginning the briefing on COVID-19, and will be bringing you that update shortly. Well, we'd like to thank you, Dr. Hamer, for your time. He is a consultant public health practitioner. He's joining us from Abuja. Thank you for joining us at this time. Let's take a break now. Still to come on our COVID-19 updates. The Armed Forces of Nigeria unveils digital mechanical ventilator. That's in a moment.